Hi friends, welcome back my channel 10x Health Nutrition. Today we discuss about statin drug side effects, symptoms and support strategies. How statin drugs work in our body. What happened to our body when you take statins. Statin drugs are some of the most commonly prescribed medication. They are used to lower your bad cholesterol levels and supposedly reduce your risk of cardiovascular disease, heart attacks, and stroke. Statin drugs may be common, but they don't come without side effects. There are some fantastic natural support strategies that you can use to protect your health and reduce your risk of statin drug side effects or needing the medication in this first place. In this video, you will learn about statin drugs. You will understand what statin drugs are and how they work. I will discuss common side effects and major risk factors for these side effects from statin drugs. You will learn about how statin drugs may damage your mitochondrial function. I will discuss whether or not high cholesterol is really a problem. I will also offer some natural support strategies to help you overcome statin drug side effects. What are the statin drugs? Prescribed to lower cholesterol level. Taken by 22% of Americans over the age of 45. Generate over $14 billion in sales per year. Statin drugs block the activity of the specific liver enzymes involved in cholesterol production. Type of statin drugs: fluvastatin, atorvastatin, pravastatin, simvastatin, pitavastatin, lovastatin, rosuvastatin. Pfizer was selling statin medication with over $2 billion per year. What are statin drugs? Statin are a type of medication that is commonly used to lower low density lipoprotein or LDL or bad cholesterol, reduce the risk of cardiovascular disease and stroke, and prevent cardiovascular disease from getting worse. They may also help protect your arteries and improve your high density lipoprotein, HDL, or good cholesterol level. There are 7 types of statin drugs available on the market today that are currently approved by the US Food and Drug Administration. They include fluvastatin, atorvastatin, pravastatin, simvastatin, pitavastatin, lovastatin, rosuvastatin, etc. Statins are the most commonly prescribed pharmaceutical drugs in the world. While most people don't experience too many noticeable adverse side effects, some people experience some negative side effects that can interfere with their daily lives. There are also some risk factors that you need to know about that I will go over this video. What happens to your body when you take statin? Statin works by blocking the production of cholesterol in your liver. lowers cholesterol, essential for cellular function. Brain is 30% cholesterol and depends on continual production. Makeups vital hormones such as testosterone, estrogen, and progesterone. Low cholesterol leads to fatigue, weakness, brain problems, and degenerative disease. Lowers coenzyme Q10, necessary for cellular energy production, power intracellular antioxidant. Low level can result in muscle weakness, fatigue, lowered immunity, brain problems, and degenerative disease. Common side effects: muscle pain, weakness, erectile dysfunction, memory loss. Long-term risks: depression, Alzheimer's, dementia, poor cognitive function. What is the fact? Statin may help if you have already had a heart attack. However, there is still no conclusive evidence they prevent heart disease. How do statin drugs work? Statin drugs block the activity of the specific liver enzyme HMG coenzyme reductase that is in charge of cholesterol production. The general theory is that if you have too much cholesterol in your blood, it can result in plaque buildup on the artery walls, which can lead to the narrowing or hardening of your arteries. This increases the risk of blood clots, heart disease, heart attacks, and stroke. By reducing cholesterol production, the idea is the statin lower the chance of plaque buildup and consequently blood clots, heart disease, heart attacks, and stroke. But is this theory true, and does reducing cholesterol production really save lives? A 2017 study published in Circulation found that statin drugs can decrease coronary heart disease related death by 28% in men. While this may sound great, once you dig deeper into the research, it may not be as impressive. There is a difference between relative and absolute risk. Let's say drug can reduce your risk of developing your risk of a condition by 0.5%. That's your absolute risk. On the other hand, drug B can decrease your risk by bringing it down from 0.5 to 0.25%. How do you report this? There is two ways to go about this. Your relative risk was lowered by 50% from 0.5 to 0.25% when using drug B. Or you can report the absolute risk, which means that drug B only lowered the risk by a mere 0.25%. Reporting the relative risk sounds much more impressive and can inflate the benefits of a medication or other treatment. This is what happened with statin drug studies as well. Why the numbers matter? Relative risk. New wonder drug reduces heart attacks risk 50%. Absolute risk, new wonder drug reduced the heart attacks from 2 per thousand to 1 per thousand. Statin drug given for 5 years for heart disease prevention without non-heart disease. Numbers need to treat. None were helped or life saved. In 1 in 104 were helped preventing heart attack. 1 in 154 were helped preventing stroke. Numbers need to harm. 1 in 50 were harmed, developed diabetes. 1 in 10 were harmed, muscle damage. The absolute risk is more useful at conveying the true impact of an intervention, yet is often underreported in the research and the news. Are statin drugs effective? A 2017 meta-analysis published in Lancet looked at 26 randomized trials. They found that statin drugs can decrease mortality by 10% for every 39 mg per dl. However, if you look at the trials closer, the mortality rates went from 2.3 to 2.1% for every 39 mg per dl, resulting in only a 0.2% absolute risk reduction. Now, looking at vascular related health, statin drugs only decreased death from 1.3 to 1.2%. Of course, every single life matters. Some may urge that even 0.2% risk reduction matters. But if we are looking at the big picture, 98.2 out of 100 high-risk people will not see any heart health benefits from statin drugs. The 1.8 remaining individuals who do see benefits will only live about 6 months longer on average and a maximum of 1 year longer versus those who did not take statin drugs. Not to mention that these statistics are only true for high-risk individuals, middle-aged men who have already had at least one heart attack. There is currently not much evidence that statin drugs can benefit when without pre-existing heart disease. There is also no evidence that they can help a woman with or without a heart condition. How, how statin drugs works? Statin drugs are HMG coenzyme reductase inhibitors. This means that they block the critical rate limiting enzyme in the liver. Hydroxymetaglutarate coenzyme A, shortened to HMG coenzyme. Blocking this enzyme blocks that production of all form of cholesterol. Major side effects of statin drugs. Muscle pain is one of the most common side effects of statin drugs. However, you may experience some other mild or more severe side effects using this medication. Some of the most common side effects of statin drugs include headaches, muscle aches, weakness or tenderness, difficulty sleeping or sleep issues, drowsiness, dizziness, skin flushing, rashes, acne or skin issues, stomach pain or cramps, nausea, vomiting, gas, bloating, constipation, diarrhea, low platelet levels, high blood sugar levels, etc. Furthermore, statin drug may also increase your risk of diabetes and skin condition. Statin drugs may decrease your risk of a heart attack and increase your life by a little if you are a man with pre-existing heart disease. However, a 2019 study published in Diabetes Metabolism found that statin drugs can double your risk of diabetes. Your risk are the highest if you have been taking them for 2 years or longer. Another 2019 study published in the British Journal of Clinical Pharmacology found that statin drugs can also increase the risk of staph skin infections by 40%. They found similar rates of skin infections in those with and without diabetes, which suggests that the infections were not only a complication of diabetes but the side effect of statin drugs. So if you want to learn more for a stay healthy lifestyle or a disease-free lifestyle, contact us. Take control your health today in your health. See you the next video. Thanks for watching this video.